computer. Okay, now we're recording.
Okay.
Let's see how we're doing. All right. Hi, everybody. I'm Missy. Most of you know me well, but I'm here today to help you guys bring your concrete supports in times of need piece to the group. And today we're talking about the FAST program available through Northern Lakes Community Mental Health. And I'm here with Lauren Franklin, and she is one of the coordinators of the program. And so we're here to find out a little bit about what is FAST and what can this help parents with.
All right. So the FAST program is the Family Assessment Safety Team. We are a mobile crisis team for kids. Mm-hmm. And so what we're trying to do is just provide an extra resource for parents and families and schools, really anyone in the community that's dealing with a crisis. And what this is we had been seeing a lot of kids that were ending up in the emergency department for non-medical issues, and that they really didn't need to be there, and it ended up adding more trauma to the family, to the child. Oftentimes they were being taken there by police, and it was just a hard time for everyone involved. So we really wanted to become that sort of middleman, and we want to be someone that they can call and feel comfortable with, and we will come out to see them. So like I said, we're a mobile crisis team. We have a team of 2 that would go out into the community, whether it be your home, a school, your parking lot.
Wherever the crisis is happening, right?
Anywhere the crisis is happening, we will come on out and we will kind of just de-escalate and work with the family and work with whoever's involved to come up with a safe solution. And so, like I said, it'll be a team of 2, a master's level clinician and a bachelor's, and we'll talk with the child, kind of see what's going on, see what caused this crisis, what kind of triggers, what kind of stressors are happening in the kiddo's life. And then the second person will be talking with the parents, trying to get resources and what sort of barriers that you guys are facing and what sort of connections we can help make. And so, like I said, we're just trying to keep the kids from experiencing more trauma.
Okay. Yeah. So give us an example of when would somebody call the FAST hotline versus 911?
Okay. So for the FAST hotline, we do not define a crisis. We leave that up to the parents, leave that up to the child. So, I mean, we get several calls. It could range anywhere from the child forgot their lunch, they missed the bus, and their whole day has just been thrown out of whack. Mm-hmm. They're just in this mood. The parent doesn't really know what to do, and it's getting a little out of control. That's a perfect time to give us a call. And like I said, we come out to you, but if also you just need to talk to someone over the phone and kind of get reassurance on what's going on and maybe some guidance, we'll do that as well. And then we'll go to the other side of the spectrum, the more severe. Say your child is experiencing suicidal thoughts. They've maybe even done some superficial damage. That's something that you want to call the FAST team about. We like to say, unless it's medically necessary, give us a call first.
Okay, that's a great way to think about it.
Yeah.
And so this hotline is out of Northern Lakes Community Mental Health, which serves Grand Traverse and Leelanau counties. However, if you live in Antrim, Kalkaska, Benzie counties, this number is still available for you to call, and they can connect you right with the...
Yep, connect you with your local resources. It's not like you'll call this number, we'll ask where you are, and then we'll hang up. That will never happen. Mm-hmm. You give us a call, and we'll do what we can in the moment to help you de-escalate the situation, but then, we'll also connect you with your local sort of resources.
Well, and, from what I understand, you don't have to come actually to the person at all. If you're more comfortable talking over the phone, that's an option as well.
Yeah, like I said, say another situation is you come across your daughter or son's diary and they're expressing some pretty scary things that you didn't know what was happening in their life. And the child may not be in like a visible crisis right then and there, but it's something that, you can call us and be like, I just found this really frightening entry and I don't know what to do about it. And so that's something where we can talk over the phone. We can schedule a follow-up visit. So if you and your child want to come in the next day, later in the week, whenever works for you, we could schedule a visit with one of our therapists and they could kind of talk through. And again, we do more follow-up.
And I can't help but think, I was a parent of school-age children. Sometimes you come up with things happen between other families, other kids, there's sensitive situations, how do I deal with this? And sometimes it's probably nice to have that third party that's neutral, that could help offer some guidance without without being, you having to call a friend, and then there could be conversations that get spun out of control.
Yeah.
So I can see how that would be a really useful tool for families to have just someone on the phone to call and say, oh my gosh, this has really floored me. What do I do? How could I think about this?
Exactly. And it doesn't matter what insurance you have. We see any insurance. Like I was saying with the follow-up, if you don't have a counselor already set up, and this is kind of like a first-time thing, we can continue to see the kid and their family for up to 90 days. I mean, we want to make sure that this is a one-time crisis. I mean, we understand that crises do happen quite often, but we're trying to avoid seeing the same kid for the same thing. We're trying to get to that root problem and figuring out what's happening within them and what we can do to connect them to resources in their community eventually.
And is this something like, if law enforcement is involved, is that okay to still call FAST if law enforcement?
We are actually working with law enforcement as well, so they know, say they come up to the scene and they've been called for some domestic sort of disturbance and they realize it's a mental health thing, they call us. We have them part of our committee, so they're very well versed in the FAST protocol. And so it's also something that if we think that we need to call them, we're very back and forth, really good communication with them. And if a family, we'll always ask them what sort of risks, like what's happening at home. And if they request a police officer, we'll give them a call. And
because this is specifically, I don't know if we even stated the ages, but this is really designated for children ages 0 to 20. And not oftentimes our law enforcement have a lot of great training, but sometimes it's not always real specific to kids in a crisis that's not medical or I don't know. Do you want to speak to that a little bit?
I mean, that's again, it kind of ties in with the emergency department thing. As we were seeing a lot of law enforcement were bringing the kids to the emergency department because they didn't know what to do. I mean, as a parent, as an official like that, they thought, where's a safe place? Okay, the emergency department, which is very true. It's a confined environment. It's controlled, but like I said, we're trying to break away from that. So now that the police officers know about this, we've actually had trainings with them.
Good.
They are very close connected with this team. They're super thankful for us as well because they don't like going into a situation where they're not sure what to do.
Yeah, right.
So, I mean, they love calling us.
That's great. So, look, everyone loves FAST.
They do.
That's terrific.
So, I mean, like I said, we're really trying to work with everyone in the community. It's a real big community effort to just kind of wrap around all sorts of services and make sure that this kid and the family is getting everything that they could need.
That's awesome.
Yeah.
Lauren, thanks for talking to us today. We hope that you found this conversation helpful in understanding what FAST is and what it can help you with as a parent in our community. And we will make sure that the link and the information to the FAST program is available for you within our social media and digital offerings. Thanks so much.